Welcome to this informative video about neurofibromatosis, or NF. This genetic disorder affects the nervous system, causing tumors to grow on nerves throughout the body. In this video, we will explore the causes, symptoms, diagnosis, and management of this complex condition, aiming to provide a comprehensive understanding of neurofibromatosis. The primary cause of neurofibromatosis is genetic mutations. These mutations can occur spontaneously or be inherited from a parent. There are two main types of neurofibromatosis, NF1 and F2, each caused by mutations in different genes. NF1 is caused by a mutation in the F1 gene located on chromosome 17, which codes for a protein called neurofibromin. This protein acts as a tumor suppressor, regulating cell growth and division. And F2 is caused by a mutation in the NF2 gene located on chromosome 22, which codes for a protein called merlin, also known as schwannomin. Merlin also acts as a tumor suppressor, primarily in Schwann cells, which insulate nerve fibers. At the cellular level, the mutated genes in NF1 and NF2 disrupt the normal regulation of cell growth and proliferation. In NF1, the deficiency of neurofibromin allows cells to grow and divide uncontrollably, leading to the formation of neurofibromas, which are benign tumors that grow on nerves. The lack of neurofibromin can also activate the RAS signaling pathway, further promoting cell growth. In NF2, the deficiency of merlin disrupts the structure and function of Schwann cells, contributing to the development of tumors, particularly vestibular schwannomas, which affect the auditory nerve, and meningiomas, which affect the meninges, the membranes surrounding the brain and spinal cord. Neurofibromatosis affects people of all races and ethnicities equally. NF1 is the most common type, affecting approximately 1 in 3,000 to 4,000 births worldwide. NF2 is less common, occurring about 1 in 25,000 to 40,000 births, because the mutations can be spontaneous. Many cases arise in individuals with no family history of the condition. Accurate statistics can be challenging to obtain due to the variability in symptoms and the possibility of underdiagnosis, especially in milder cases. The signs and symptoms of neurofibromatosis vary widely depending on the type and severity of the condition. In NF1, common signs include kaphi, late spots, which are flat, light brown birthmarks on the skin, and neurofibromas, which are soft fleshy bumps that grow on or under the skin. Other symptoms can include Lich nodules, which are tiny benign growths on the iris of the eye, and bone abnormalities, such as scoliosis or bowing of the legs. In NF2, the most common initial symptom is gradual hearing loss, often accompanied by tinnitus or balance problems due to the growth of vestibular schwannomas. Other symptoms may include headache as vision problems, facial weakness, and seizures. Both NF1 and NF2 can also cause learning disabilities, developmental delays, and an increased risk of certain types of cancer. Diagnosing neurofibromatosis typically involves a thorough physical examination, a detailed medical history, and various diagnostic tests. For NF1, the diagnostic criteria include the presence of at least 2 of the following 6 or more kaphi, late spots larger than a certain size, 2 or more neurofibromas or 1 plexiform neurofibroma, a large tumor involving multiple nerves, freckling in the armpits or groin area, Lich nodules, a distinctive bone abnormality, or a first-degree relative with NF1. For NF2, diagnostic criteria in the presence of bilateral vestibular schwannomas or a family history of NF2 along with unilateral vestibular schwannoma or other qualifying tumors, such as meningiomas or gliomas. MRI scans are frequently used to detect tumors in the brain and spinal cord, and genetic testing can confirm the diagnosis by identifying the specific gene mutation. There are primarily 2 main types of neurofibromatosis, neurofibromatosis 1 and F1 and neurofibromatosis type 2 and F2. A less common type is schwannomatosis, which is characterized by the development of multiple schwannomas throughout the body, but typically without vestibular schwannomas. Each type has distinct genetic causes, clinical features, and diagnostic criteria. Currently, there is no cure for neurofibromatosis, so treatment focuses on managing symptoms and complications. Regular monitoring by a team of specialists, including neurologists, dermatologists, ophthalmologists, and oncologists, is crucial. Treatment options may include surgery to remove tumors that are causing pain or compressing vital structures, medication to manage pain or seizures, and physical therapy to improve mobility and function. For individuals with NF2, hearing aids or cochlear implants may be used to manage hearing loss. In some cases, radiation therapy or targeted therapies, such as mTOR inhibitors for F1, may be used to shrink tumors or slow their growth. Since neurofibromatosis is a genetic disorder, there is no way to prevent it from occurring. However, genetic counseling is recommended for individuals with a family history of NF who are planning to have children. Genetic testing can determine if a person carries the mutated gene and the likelihood of passing it on to their offspring. Prenatal testing, such as chorionic villus sampling or amniocentesis, can also be performed to diagnose NF in a developing fetus. The prognosis for individuals with neurofibromatosis varies widely depending on the type, severity, and location of the tumors. Many people with NF1 lead relatively normal lives with proper management of symptoms. However, some individuals may experience significant complications, such as chronic pain, learning disabilities, and an increased risk of cancer. The prognosis for NF2 depends largely on the growth rate and location of the tumors, particularly vestibular schwannomas. Early diagnosis and treatment can help to preserve hearing and prevent neurological complications. Ongoing research is focused on developing new therapies, including gene therapy and targeted drug therapies, to improve the lives of those living with neurofibromatosis. Recent advances include the FDA approval of MEK inhibitors for treating plexiform neurofibromas in children with NF1, representing a significant step forward in the management of this condition.